province, less than 10% of family doctors gave a positive answer. This is not good. Then, when they sent the invitations to relatives, only 1/3 of people came for screening. Maybe they were not informed properly. And this is not good. Also, there can be a difference between centers for endoscopy. This center, Altamura, I'll show you where it is. They took all patients, they performed all endoscopies, invited patients and also patients who came spontaneously. So they look quite active. But this unit, 6 patients refused, 4 patients refused, and they are lost to follow-up. And this is not good. So, for example, what happens in this Altamura, this is one of my colleagues, Giuseppe Scaccianoce. Here is Altamura. It's a very interesting place. And they perform over 1,400 colonoscopies. This is the yield, 57 colorectal cancer in 2008, 3 on polyps, 348 patients with polyps, and 590 polypectomies, and 2,000 EGDS. So this was a center looking for patients to screen. The second part of the project never has started, and they also calculated this amount of subjects to be screened with occult fecal blood, so large numbers. We estimate a compliance of 30% of patients, positivity of 5%, so we need 7,000 colonoscopies in 3 years. And there are some tasks for endoscopies and for family doctors, what to do and how to evaluate the success of the program, positive, negative result, endoscopy, and kind of lesions. So what do we learn here? Is that the screening for colorectal cancer is cost-effective. Everybody in the world is suggesting this. The politicians should be aware that we can save life, and then in the long run, these people will be working and not sick, and they will not die. If family doctors are not motivated and do not adhere to the program can fail. So you are the most important part of the project. And we need some investment because these programs are costly. Here are the costs in the region of Puglia. First year, 2.3 million euros. Year 2, year 3, around 1.3 million euros. What could be a nice Romanian screening program? Please decide the target population. How many years you want to study? 3 years, 5 years? Which diagnostic tools? You need blood and feces, calprotectin for inflammatory bowel disease, colonoscopy, other. You need epidemiological data. I heard something before. You need to identify who is getting the information. Family doctors with computers. You need endoscopic standards and secretariat, pharmacies, hospital. Maybe it's better to start with some pilot studies in a referral center, academic. You need to estimate the costs and, of course, support. Government, European community, private. Don't forget funds for young endoscopists and gastroenterologists, and even for GPs. Because in Italy, in Apulia region, GPs were promised 10 euros per patient. Then the law changed, and these euros, that amount, was taken into the new contract. They didn't get any money. So this might be a reason for the failure. So please bring some good results next year at this meeting. I'm organizing Bari in February, the meeting of the European Society for Clinical Investigation. And here is Cluj, here is Bari. This is a beautiful land to discover. Va mulțumesc!
Thank you very much indeed for your excellent presentation. I will proceed now to our last speaker. I invite Dr. Attilio Citrino, who is involved with the scientific development of the company Sofar, to introduce the techniques that you market.
Thank you. I am very happy to be here, and I am very impressed about the presence of all these professional people and for the organization. And I can explain a little what is our company, that what means Sofar in this program. Sofar is an Italian private family company that was founded by our president, Dr. Alfonso Labruzzo, in 1968. And he is a pharmacist, and started the activity with preparation